Good afternoon, everyone, and thank you for joining the webinar on detoxification, a holistic approach backed by science. I will just give another 1 or 2 minutes for people who are coming in, who are in traffic, etc., and then we can get going. I hope that you have a beautiful weather like we have right now in Northern California. The perfect spring weather, a good time for detox. So we'll start in about a minute or so. Just take a few seconds. You can just sit. If you're sitting on a chair, you can just feel the connection between your sitting bone and the chairs. You can lift your shoulders and just relax. Take a few deep breaths. Detox is about creating space, and breathing is the easiest way to even our tempo, our pace, and create space. Okay, so I'm going to start. It's all good. I'm feeling comfortable. We're going to start. Thank you, everybody. So today we're going to talk about detox as a lifelong process of that actually goes on all the time. So what do we mean when we say that we are actually on a lifelong process? It means that we detoxify on an ongoing basis. If you look at this diagram, the liver is the central organ of detoxification. It's really the hub that things come into. You can see that the liver gets loaded with toxins from the lungs, through our breathing, from the digestive system, through what we eat, and from the skin. In the same time, we can see that we detoxify through the lungs, through the digestive system, through the skin, and through the kidneys, through the bladder. So really, when we talk about detoxification being a lifelong process, every time when we exhale, we actually detoxify. Every time when we inhale, we are nourishing ourselves. And there is an ongoing dialogue between detoxification and nourishment. And the dialogue between the two is what will allow us to either heal or to get sick. So when we look at detoxification activity within this context, we understand that detox is much bigger than just doing a liver cleanse or a colon cleanse, etc. It's really what happens to us all the time. When we are born, the first thing that we do is we exhale and we cry. When we leave our body, the last thing we do is we exhale. So the letting go process is the first thing we do when we come to this world, and the last thing we do. So within the detoxification activity, there are a lot of factors that play a role. Our genetic polymorphism, which means our genetic tendencies. Are we able to detoxify well? Do we detoxify better from the skin? Do we detoxify better from the lungs or from the liver? There are different stations where detoxification can affect us. What is our age and gender? What is our diet and lifestyle? Are we having a diet that is loading us with toxins? If we want to detoxify, are we having an anabolic diet? Are we trying to build tissue while we detoxify? Not a good idea. And how is the environment affecting us? And what other diseases we have which are affecting the detoxification activity? And all of this will come into play when we look at the detoxification program. So there are levels of detoxification, and this is a term it's really borrowed from Asian philosophies, what is called body, speech, and mind. So when we detoxify, we can detoxify our body, our substance, our form, our tissues. We can detoxify our speech. When we say speech, which the idea is things that we can't hold to, things that we can't substantiate, things that we can't see with our senses, like subtle energy that moves in the body. People who have done Qigong or have gotten acupuncture, movement, breath, and emotions. So detoxification really includes emotional detoxification. Today we don't have a lot of time, but the emotional detoxification is different during the spring or during the fall. And then what happens in our mind when we detoxify? what thought patterns, what intentions are involved in the process. So for example, from a mind point of view, it's good to decide before you start detox, what do you want to get rid of? We tend in the mind to hold to things. We hold to feelings, we hold to traumas, we hold to thoughts, we obsess about them. So the idea of the letting go is part of detox. And we know in life that sometimes the emphasis is of letting go physically, we go on a certain diet, letting go emotionally, energetically, we do exercises, we work with our breath, we work with our emotions, and letting go of our thought pattern. Because every thought that comes up is going to come down. That's the nature of thoughts. So when we look in this context, we now can understand the big picture of detoxification, the holistic approach. Again, I'm just touching briefly on something going to be very profound. When I teach 5-7 days of meditation and healing retreat, we really go into this integration of body, speech, and mind, all the levels of our being. So when we look at detoxification, it's more than just binding toxin. For effective detoxification to take place, it's really an integrative process that has to be supported on multiple levels. And each of us may require different support for the process. Each of us is a whole world, really. Holistic medicine is really a medicine of N equal 1. Each of us is a whole medicine. Each of us needs their own specific process, which is very different than the way we are used to function in medicine, where we want protocols and regimens. So we start by preparing. We prepare by having our mental thinking what we want to get, being emotionally ready to let go, and by preparing our body. So let's look at the preparation. Really, the concept is that when we let go of what no longer serves us, we create space for what's meant to be. And the easiest place to understand it is with breathing. In order to inhale, we have to exhale, just like we talked when we come to this world. The baby cries first, they empty their lungs, which is the passive process, and then the lungs now can expand and bring air in. So in order to nourish ourselves, we always have to let go first. And that's the idea of the process. So this means also setting up time for detox. If you have a very busy day that is totally loaded and you want to end on top of it a detoxification process, I can tell you the benefits will be limited because you don't have the space for detoxification. You don't have the space to allow for things to change, to allow for the letting go process that will then allow the space for new things to come in. And that's the rejuvenation part of detox that requires this letting go. So in order to detoxify, we need to expose what we want to get rid of. So part of it is also we want to control the rate of accumulation. How much toxins are we taking inside? So one of the, for example, of the ways to control it is we control our diet during detoxification. We move to a lighter, higher in green, free of sugars, that free of gluten, preferably free of milk products, and a lower fat diet. Why do we do this? Because we want to remove things that are sticky, things that are accumulating. So if you take sugar and you wet them, they become sticky. Gluten is very sticky. Milk products are sticky. So we want to move this thing. We want to have a lighter diet, but we want to have enough protein, especially amino acids, especially sulfur amino acids, to allow ourselves the detoxification process that the liver needs. So now that we control the rate of accumulation, we, for example, drink clean water. We don't drink soft drinks. We don't drink too many stimulants. Now we are controlling the input. And then we want to expose the toxins, which we'll talk in greater detail a little bit later. It's a very important topic. And gather detoxification forces, meaning have in our system enough energy to deal with the detoxification. You know, when we clean our house with a broom, we need to move the broom. We need an energy to move things. And that's part of the detoxification process. From the point of view of creating space, creating time, creating intention. Very important. You set yourself for a more profound process. And so modern lifestyle in many instances leads to chronic inflammation. It leads to toxins accumulation. It creates hiding places for toxins that, as much as we have time, I want to elaborate about it, what it means, hiding places for toxins. And it reduces our capacity to detoxify. So all of this we want to change during the detoxification process. And today we'll focus more on the understanding and on supplementation. We won't talk in greater detail about diets because there are so many detoxification diets that are very similar and are available. So then, once we prepare and we expose, now we got to bind to the toxins. So we bind to them in two levels. We bind to them in the gut before we absorb them, or after they were excreted and we want to prevent the reabsorption, without interfering with nutrient absorption. And we bind to them in the tissue and the circulation in order to deliver them to the liver, which will then help us to get rid of them through either the gut or the kidneys or the lungs or the skin. So the basic detoxification in the liver is divided into two basic categories that I don't want to go in greater detail: phase 1 and phase 2 detoxification. Phase 1 is a process where we take lipid-soluble toxins that we cannot excrete because they're not water-soluble, and we prepare them, we activate them, so then in phase 2 we can make the right connection to them so we can get rid of them. So obviously in phase 1, it's really, if you want to look at the image, is if you open all the drawers in your kitchen and you throw everything out on the sink or on the counter. So it's a mess. But if you're ready for it, and if the amount of stuff that you are throwing out on the counter, you can also clear it through phase 2, you will have a balanced detoxification. If your phase 1 is weak, you will detoxify less. If your phase 1 is bigger than phase 2, you will get stuck with toxins, and that's where you get what they call healing crisis aggravations. Oops, for some reason I got stuck in phase 1. Okay, so the phase 2 reactions is where we conjugate and we transform this intermediate into water-soluble form that is ready to be excreted. So you can see in phase 1, which is oxidation, reduction, hydrolysis, hydration, and etc., we need certain nutrients, B2, B3, B6, B12, many of the B vitamins, we need folic acid, we need glutathione, and we need flavonoid. And in phase 2, we need a little bit more nutrients, a lot of minerals, and a lot of amino acids that are sulfur amino acid, methionine, cysteine, you can use NAC, and folic acid, the B vitamins, different folic acid, different sulfur amino acids, taurine, glycine, methionine, cysteine, they play a different role. So that's the importance of having some protein when you detoxify, and that's why you see a lot of detoxification product that has a protein powder. Ideally, it will be individual amino acids, so you don't have to spend the energy to break them down. They're already broken down, so you can have all your energy dedicated to the actual detox. So we detoxify directly from the liver to bile to the intestine for excretion, on through the bloodstream to the kidneys. So when we have this process, we need to have enough energy to detoxify. We need to support the energy systems. We also need to be well hydrated so there is good movement in the body. So part of the support is to protect the circulation. So exercising, walking is very important so the blood circulation is moving. And to support the energy system by creating mitochondrial support or taking specific herbs that will support the energy system and will aid in detoxification. The classical group for this is medicinal mushrooms. And we need to keep our gut healthy through nutrients. We need to support the gut microbiome through different probiotics and prebiotics, and we need to prevent the reabsorption of toxins. Very important. Otherwise, we can get into trouble. Why we can get into trouble? Because, for example, if you broke some lipids, some fatty tissue, and you get toxins, and they get reabsorbed or redistributed in the bloodstream to other organs, instead of having mercury in a fatty tissue, you can end up having it in the brain or in the heart, and that's not a good detoxification process. Oops, I think I jumped a few slides. Go back. Okay, so when we look at this, we want to keep our reactions balanced between phase 1 and phase 2, between exposing the toxins and clearing them so they can be eliminated. So one is called discharge, where we are discharging from the tissue to the system, and one is called elimination, when we are eliminating them from the body. So when you do detox support, you need to select what's right for you. And we need to emphasize these basic steps: prepare, expose, bind, discharge, eliminate, and support and balance. So let's look at some, I want to focus on certain preparations that are especially important for detoxification. So the first preparation I'm talking about is called PectaClear, and it's a combination of pectasol-c, modified citrus pectin, and alginates. And we will see why, beyond the benefits of modified citrus pectin that many of you heard about, why in this specific detoxification instance we actually add alginates. Then we want to help the phase 1, phase 2, the preparation, the support of energy, the circulation, the elimination. And instead of taking 20 different ingredients, I've put them together into one specific product that is very sophisticated, that addresses the different needs, and we'll little bit discuss it. And then we want to add the general detoxification and the nourishment and the support of the immune system by adding, by using medicinal mushrooms that are organically grown. So let's talk a little bit first about PectaClear, about the combination of modified citrus pectin and alginates. Let me just write myself a note about something that I want to talk about. So I don't forget. Okay. So, let's talk a little bit about what is modified citrus pectin. So maybe just to recap, we're talking about PectaClear, modified citrus pectin, and alginates. So what is modified citrus pectin? Modified citrus pectin is derived from the piece of the citrus fruit peel. So pectin is a long chain of galacturonic acid, and most of it is a green color. It's esterified. So usually it has a very high molecular weight. It says here 50 to 300 kilodalton, but usually it's around 150 to 300. It's highly esterified, and it really cannot get absorbed. We modified it in a very sophisticated way to a very low molecular weight, under 15 kilodalton. We reduce esterification, and we preserve the benefits of the, you can see my arrow, I think. We preserve the benefit of the side sugars, the neutral sugar, rhamnose, arabinose, which help detoxification and chelation of heavy metals, and also stimulate the immune system. What does modified citrus pectin do? And again, what it does is it neutralizes the effects of galectin-3. Galectin-3 is what we call a ROG protein. It's a carbohydrate binding protein, a protein that binds to sugars. And what it does, it creates a lattice formation. It creates pentamers that have 5 galectin-3, and it creates a network of galectin-3 that creates a biofilm, creates a shield where toxins, infections, inflammation, cancer can hide. The modified citrus pectin breaks it down. So obviously it's an essential part of detoxification. So the 5 actions of modified citrus pectin detoxification, in the preparation phase, it reduces inflammation and fibrosis. Why is it so important? Because the fibrotic tissue is a dead tissue. A fibrotic tissue is a tissue that is no longer alive. While it's not alive for us, it's the ideal place for toxins, heavy metals, infections, viral, bacterial, fungal, parasitic, emotion that we are storing to hide from the system, like a box. And if we reduce the inflammation and fibrosis, our body can now come into the area and start cleaning it up. As part of the preparation, modified citrus pectin dramatically enhances the immune system power. Dramatically in many levels like nothing else. It is such a dramatic immune enhancing effect we have published, and that's why it's studied now. Our modified citrus pectin is studied now with immune enhancers in different cancers, for example. It exposes the toxins by acting on galectin-3 mediated biofilms and breaks them down, and then it eliminates the toxin in the GI tract or eliminates the toxin through the urination. And it binds to toxins in the body, to heavy metals and to toxins, all of this published. So you can see why modified citrus pectin should really be taken all the time. Of course, it has many other benefits, anti-cancer effects, anti-inflammatory, anti-fibrotic, but even for the detoxification, we cannot stop to detoxify. Every time we breathe, every time we eat, every time we get exposed to stress, we are filling our body with information either on the level of body, form, substance, on the level of speech, energy, emotion, level of mind, negative thoughts. They all have to be cleaned. And that's why the detoxification process has to keep going. So we actually, in the detox process, we add alginate to the modified citrus pectin. Alginate that is derived from kelp, specifically because it's built from something called hyaluronic acid, compared to manuronic acid, which is has a higher affinity for detoxification of heavy metals. When we add the alginates, it showed to detoxify and eliminate radioactive isotopes, dioxin and dioxin-like compounds, which are very toxic compounds that are present, unfortunately, in many of our water supply, pesticides, and heavy metals. So you can see the value. So there's a value as an ongoing support. As we said when we started, detoxification is an ongoing process, but we can emphasize it during periods of detoxifications. When are the classical periods of detoxification? When there is change outside, in the spring and in the fall. In the spring, we detoxify in order to be more active in the summer. The days are longer, there is more sun, there is more energy. In the fall, we detoxify to be lighter for the winter, for the hibernation, for the inward movement that we have. When the nights get long, when there is more of a letting go. So the detoxification process of heavy metal is worked through the egg model, the eggshell model, where the polyurinates, which are the pectins and the alginates, are negatively charged, and they are bind to positively charged heavy metals, mercury, lead, cadmium, but also arsenicum, also cadmium, also uranium. We're just publishing a paper. But they do not deplete essential minerals because they have such a higher affinity to heavy metals. So MCP and alginates are backed by evidence. For example, children exposed during the Chernobyl reactor accident and had high body burden of radioactive cesium, which is positively charged, pectin administration just through the digestion, not as effective as what we do now, reduced cesium by 33% compared to only 14% in the placebo. And that's really what got me going to this idea of using pectins as detoxification for heavy metals. For example, when we examine different fibers, 16 different dietary fibers evaluated for ability to absorb and remove dioxin. Dioxin again is a serious toxin that can cause immune suppression, hepatic hypertrophy, splenic atrophy, and has effect with cancer. So the pectins were most effective in binding dioxins, enhancing their fecal excretion, again, through the gut. So you can see the importance also of adding the alginate so there is no reabsorption. And these are different publications from the literature, and you can see a number of them are mine. I think the first, second, third, 3 of the papers here have been published by me, or I was part of them. So, now that we talked about the generalized detoxification that happens in the bloodstream, in the gut, we need to support the elimination from the organs, we need to support the energy support, the circulation, and provide the different nutrients that will do it. So we can do it by just taking a list of different compounds, or we can do it in an energetic, dynamic way. And I don't have time to show the whole ancient wisdom behind the formulation of EcoDetox, but I will go a little bit and explain it to you. So when we want to look at detoxification, we want to boost the discharge from the organ to the bloodstream, and we want to help the elimination, getting rid of them. So such a formula is to be balanced with activation of phase 1 and 2 reaction, has to provide energy that is provided by nutrition and mitochondrial activators, has to have the cofactors that we need for detoxification, mainly vitamins and minerals, and has to have the conjugation group donors, mainly amino acid and sulfur donors. So you can, we already looked at the lists that are needed based on the literature for these processes. Vitamin B2, B3, B6, B12, folic acid, glutathione, flavonoids, and all the other sulfur amino acids. So why we need something like this? Because environmental factors may influence phase 1 and 2 balance, leading to toxic metabolites and free radical damage. Things like smoking, things like not eating like the right food, all of them, plastics, all of them can affect us. So nutritional factors like lack of protein, fat, and cofactors may lead to an inability to detoxify intermediate toxic metabolites. There is underactivation of phase 2. So the image that I gave, you take everything from the drawers, you throw on the table, and you don't have enough stuff to clean it up. Then you end up with a mess. And then also we have genetic factors and aging that lead to mitochondrial dysfunction, lack of energy for phase 2. Just don't want to miss the last one. There was one more. I think I went a little bit too fast. Okay. So if we look at some of the select ingredients from such a formula, just a few of them, we have folic acid, the methyl donor for mitochondrial protein and nucleic acid synthesis. It's essential for methylation of DNA, of phospholipids, protein, and neurotransmitter. We have B12. We have B6, and we have sulfur amino acids, different amino acids, sulfur amino acids that are necessary for producing glutathione, the main antioxidants, for enhancing immune function, and for reducing oxidative stress. When there is cleanup, there is stress on the body. We want to reduce the stress. And we have a few botanicals. So here we're looking at the botanicals from a Western point of view, and I will give you some of the Eastern images for them. So salvia, miltirosa, danshen reduces lead accumulation in the kidneys, very important. Right as tissue is being broken down, as lead comes to the kidneys, it's one place where lead gets stored in the kidney and the bladder. We clean the lead up. Increases kidney superoxidase dismutase, the main antioxidant, and glutathione peroxidase, and protects the liver against iron overload, again, oxidative stress. Astragalus that enhances mitochondrial function. So astragalus is not classically a detox herb. Why do I use it? Because it gives the body the energy to detoxify. It protects the kidney and it's neuroprotective. So it supports the detoxification process, which is important in the brain when we are moving out heavy metals and there is oxidative stress. Chinese smilax, which is two-fuling. It's a hepatoprotective and it's kidney protective. But really what it does from a Chinese medicine point of view, the classical term, it separates the pure from the turbid. It allows the kidney, it allows the body to decide what we need to get rid of and what we need to keep. Very important element in elimination. And milk thistle, which is a classical liver protectant, and protects the body from the oxidative stress and promote regeneration of the liver. So we're moving now into the nourishment part of the liver as we are detoxifying. So we have this part. The last part that is essential for detoxification are medicinal mushrooms. Why? Because mushrooms are like sponges. Mushrooms have the property to go to areas which we call dead areas, which are not active, that the body doesn't control, areas of cancer, areas which are inflamed that have less oxygen. We have to recognize when there is less oxygen in the tissue, it becomes acidotic, it becomes covered by biofilm. We don't have access to this tissue. From the body's point of view, it's a dead tissue, we're not in control of it. But then a lot of things can happen there. There can be inflammation, there can be infection, a tumor can grow. And that's why mushrooms have such profound anti-cancer effects. So if we look at the mushroom, what they do is they help successful detoxification, which requires lifelong support and balance. And it provides support from these different places. So we can see here, if we look at the full list of the mushrooms, so there's a way to look at these mushrooms based on their effect on the past, on the present, and the future. And this effect is tied to the constituency of the mushrooms. A lot of toxins that we got in the past are stored in our fatty tissues, lipid soluble. So cordyceps, reishi, and baimu, the first three mushrooms, have high content of phospholipids. They can penetrate the brain. They will help in detox in the liver, in the brain, in the lungs. They will detox damages from the past. Hericium will clean the esophagus. Fuling will help the main digestion. Coriolus, shiitake, and maitake will help the immediate immune response and the relationship between the liver and the digestion. Muer will help, auricularia will help the end of the digestive system, the rectal area, and polyporus will help the kidney and will help to generate the immune system for the future, together with cordyceps and some other mushrooms. So if we want to look at it from a different way, we can look at it from the point of view of past, present, and future. We are healing damage from the past and detoxifying, being liver protective, anti-fibrotic. Reishi is very much like this, cordyceps is like this, anti-inflammatory, antioxidant, detoxifying. We are enhancing the immediate support with mitochondrial support, digestive support, glucose regulations, we have a normal response, cardiovascular support, cytotoxic and antimicrobial for immediate attack on wherever the problem is, and we train the immune system. Mushrooms are adaptogenic. They have adrenal support, immunomodulatory support, hormonal regulation, and they are profound prebiotics, especially the beta-glucans. So you can see how you can look at mushroom in more of an holistic preparation. So these are not just lists of 10 mushrooms. They're actually layered in a way that enhances their effect. And there are specific ratios between them that makes them work in a synergistic effect. I have a unique diagram about it that I didn't include this time. Maybe the next time I talk about the topic. So really when we look at the supplements, this is a very basic regimen that can cover the preparation, the binding, the exposure, the elimination, and it addresses the past, the present, and the future. So into this, we of course can add other things like prebiotic, probiotic, circulatory herbs, but the Eco Detox really addresses a lot of it in one specific formula. So how do we use them? For the detoxification, using pectasol metal detox or PectaClear, you really use a lower dose because we are preventing reabsorption. So during the active dose, when you're really doing detoxification actively, you take 3 capsules twice a day on empty stomach. For maintenance, you take only 1 to 2 capsules twice a day. If you are concerned about galectin-3, and you should be, and you're not doing the full dose, you can always add pectasol-c as an addition, either at 5 grams a day if you're in good health, 10 grams a day if you have inflammatory and fibrotic issue, or closer to 15 grams if you are dealing with cancer. But again, you can deduct the amount that you are getting from the pectasol metal detox. You do the full dose of the pectasol metal detox, you need only 10 grams of modified citrus pectin to add 5 in the morning, 5 in the evening. The detox complete, again, when you load, you take 3 twice a day. In maintenance, it's 2 twice a day, and then you can even after 2-3 months go to 1 twice a day, just to give the message to the body to keep detoxifying. And again, we focus on higher dosages on a stronger detox program during the spring and the fall, or before a big medical procedure or after a big medical procedure, like after chemotherapy, after radiation. And you add the mushroom immune support, the 10 mushroom formula. You take 4 twice a day during the loading period, and some people have a weak immunity, have need for support all the time. They take 4 twice a day all the time. I really call it the ultimate mushroom nutritional support. It really covers all the systems in the body. And for maintenance, you take only 2 twice a day. And into this, again, you can add prebiotic, probiotic, circulatory. So to summarize the topic, we prepare the body by reducing of inflammation, stress, and fibrosis. So by taking time, by setting up time during your dedicated detox time to be better hydrated, to eat a better diet that is cleaner, lighter, higher in greens, but has enough protein, but cut the sugars. We also prepare ourselves mentally, emotionally. We expose the toxin by enhancing immune surveillance and addressing biofilms. Biofilm that we didn't go into detail today, but biofilm that we break down mainly by using modified citrus pectin. We bind toxin effectively in the gut and inside the body. We help the discharge and elimination. We talked about it using Eco Detox. We support healthy gut, microbiome, and balanced metabolism by using probiotic, prebiotic, digestive formula like integrative digestive formula or other formulas that give heat and energy to the system, and by helping with the 10 mushrooms that help the system to flow. So I want to thank you very much for taking the time. If you have any questions, I apologize that we don't have live questions. I guess we have a few of them. So I guess I do have a few minutes, so let me look at what I got. So a few questions. One, how should I take modified citrus pectin, or if I take all the time, or the PectaClear, the Pectasol detox? Take it about 15 to 30 minutes before food is enough, or 1 hour after, best on empty stomach. And again, the galectin-3 blocker, modified citrus pectin, should be taken all the time. If you ask me what is your most important dietary supplement, if you had to take one thing, it would be pectasol-c modified citrus pectin. Because galectin-3 is at the root of almost every chronic disease. When you do the detox, that's when you go to this regimen and you add the PectaClear, the Pectasol detox. Definitely. What about if somebody has diabetic metabolic syndrome or metabolic issues? So if someone has insulin dependent, then of course it's a serious issue. You have to keep taking your insulin. But if you detoxify, and you detoxify gently, watching it you don't have hypoglycemias, you reduce your body fat, you will reduce your insulin resistance, and you'll probably be able to lower your insulin needs. But more important, you will reduce the side effects of diabetes. So galectin-3 drives diabetes and some of the side effects of diabetes, kidney damage, heart damage, microvasculation damage. So very important. So this regimen that I gave today is very effective for people who specifically have diabetes, but to this you will add our metabolic defense or glucose control that is more specific, addressing this, some circulatory formulas. So how long should detoxification be? It's another question that I just got. It depends on how much time you have. You want to have the detoxification wants to have a beginning, a middle, and an end. So some people do it for just a few days, and you'll still have an effect. Classically, you do it for 2-3 weeks, and you make a point of doing it during the spring, and during the fall, or during the time when you have time off, when you have more time. One question that I also getting is the address to email really events@betterhealthpublishing.com? No, we are missing an H. So you should add an H when you're emailing us actually to events@betterhealthpublishing.com to get our other events. And maybe last thing that I'm getting, can I enhance my detoxification if I don't have any severe health problems, so I'm not going through chemotherapy or radiation? So one thing that I really like to use is a lemon and olive oil preparation during the night. And maybe we'll send the recipe out to people who register for the webinar. And again, if you have a problem with gallstones, then don't try it or do it under professional healthcare, or start with a very low dose, like 1/4 of the recommended dose. And also if you're in the middle of harsh treatments. So I want to thank all of you for joining me today, and we'll follow up with some more information and regimen. And thank you for the opportunity to be with you today.